What is your name?
I'm Christine Bishop.
And in which city and country do you work, or are you based?
I'm from the Boston area in Massachusetts in the U.S.
Great.
And from Brandeis University.
Excellent. How would you explain what you do to a layperson?
I'm concerned with issues of policy toward long-term services and supports for older people, particularly with the economics of how we pay for care and how care is provided. So I've really spent my career applying economic models to care delivery.
Great. And what is commonly understood as long-term care in the U.S.?
There's really a distinction between what's covered by health insurance, acute care, and long-term services and supports. They're paid for differently. And long-term services and supports would be care that is compensating for disability.
Okay, great. What would you say are the three main policy priorities for long-term care in the U.S. at the moment?
At the moment, the things that, at the moment, our concern is really with implementing our Health Reform Act. So there's not so much concern with long-term care. In the policy arena, the interaction between acute health care and long-term care has become important as we deal with our dually eligible population, people who are eligible for both Medicare and Medicaid. And there's a feeling that if we can supply more long-term services and supports and more coordinated care, we can perhaps save on the acute side. So the concern with saving healthcare costs has come into the long-term services and supports arena. The concern that I see overall has to do with sharing the risk of paying for care in the future. People have a risk of needing long-term care services, and we don't have good ways of sharing that across a large population.
Okay. And what's your sense of the extent of change of these priorities over the last 5 to 10 years?
Long-term care has pretty much been on the back burner for a long time in terms of not being the focus because we have people who are uninsured for health care. It certainly comes to the fore for older people who are spending down their assets on Medicaid, to get to Medicaid. So in individual cases, people certainly are confronting this, but it hasn't been a big issue in the policy arena. Except for our Class Act, which was part of the ACA and was not able to be implemented.
Okay, and where do you see long-term care policy or the long-term care system going in the next 10 years in the U.S.?
The demographics are interesting. We talk a lot about the baby boomers turning 65, but in fact there's even going to be perhaps somewhat of a dip in the need for long-term services and supports in the next few years as the Depression era babies get into long-term care need. I guess over the next 10 years, we really are going to have to figure out how to build this foundation for retirement, for this to address this risk in retirement that people have. Not only the risk of having not having enough income, longevity risk, and not having enough for health care, but also for long-term care. So seeing this woven into our retirement system could be something that could happen over the next 10 years.
Okay, interesting.
I also feel that the workforce for this for these services is very important, and that's the work that I've been doing most recently. And for better quality long-term care, we really need a better. We need to pay attention to who's doing the work and what kind of work is being, how the working conditions are being organized.
Okay, and how do you see the financial crisis affecting long-term care?
Well, the U.S. and so much of it is privately financed. When people now have less to retire on and are unable to retire, they're going to have less to pay for long-term care. So it will have an impact over the next years that people's assets have been cut down.
Okay. And if you had the opportunity to introduce one new policy reform, what would it be and why?
I might focus on an area that's very, as I say, important to me rather than globally solving this very difficult problem. And that would be to work with nursing homes and nursing home workers to make more widespread the practice of making nursing homes more home-like, more relationship-based, nursing home care as more individualized and less institutional for the people receiving care in nursing homes. I think this is just very, very meaningful for the people who need that care, that it be more individualized to who they are, and that involves a workforce component, of course, where people are able to relate to the residents and provide care that really meets their needs.
Okay. And in your view, what's the most important piece of policy or research evidence that we still need in order to make changes or to inform U.S. long-term care policy?
I think we know an awful lot about the risks of long-term care, about the importance of workers who are committed and respected, all of these different pieces. We know a lot about that, but there just doesn't seem to be the knowledge in the general population of how important these things are and what it will mean to them when they need long-term care. So people don't necessarily vote with this as a high priority. And speaking as an economist, we don't have a public willingness to pay for these things. There would not be a shortage of long-term care workforce if we were willing to pay what people need to be paid to do a good job, and if we were willing to share risks across all of us who face these risks. So I am not sure it's knowledge, but more political will. That's our issue.
Okay, great summary. A few quick fire questions.
Okay.
On a scale of 1 to 10, could you tell me what policy priority is allocated to long-term care in the U.S.?
2, I'm afraid.
How aware is the general public about what the long-term care system offers to people in need of in terms of care?
Again, I would put that quite low. The general public would be more like a 2.
Okay. And how well does the system support people with long-term care needs?
It depends on who you are, where you live, how much money you have. So the variability is a real problem. And so that's going to be hard for me to put a number on.
Okay. And how well does the system support the needs of carers?
I would put that pretty low too, two or three.
Okay. And how integrated are health and social care services in your country?
Not very well integrated, but I wouldn't put a high priority on integration per se. I would think more about coordination and cross elasticity of demand and the like. So I'm not sure we have to have a uniform integrated system. I think systems that talk to each other might be better.
Okay. Thanks very much, Christine. Thanks for your time.
Okay.